So Vitae, for the rehab setting, what it brings to the table is a hospitalist model that is already there in the acute care setting into the rehab setting.
We are nurse practitioners, we're providers that are in these facilities every day, Monday through Friday, and we get to see these patients on a pretty regular basis. The continuity of care is great, so we can really monitor their progress and any changes that we might see in these patients. And ultimately, that reduces our readmission rates at the hospitals, which saves everybody money and better outcomes for the patients.
The hospitals are now being scrutinized more than ever to provide quality outcomes for their patients, not just in the hospital setting, but out in the community as well, and part of the community is the nursing home. So where we come in is we have these nurse practitioners come to these facilities and we dedicate one NP to one specific SNF on a full-time basis. By being there every day, they're there nurturing the nurses, they're helping the patients.
Generally, patients come to us because they're not ready to go home yet. So they need that step in between to make sure their medications are still managed, to make sure they get enough rehabilitation, to make sure that they're stronger prior to transitioning to home. I feel a role in which I work on or try my best to prevent rehospitalization.
We try to reduce the amount of times we need to send them out for hospital visits. I can catch things much faster, partly because I do know them and then I can order the testing necessary and treat something. But then also with patients that are only there for short-term rehab, we can try to figure out what is needed to get to that point faster, and also if there's something that's going to delay it, get that taken care of.
Nurse practitioners don't just deal with the nursing team and talk with the family. They actually provide education as well, as far as what to expect, how to deal with specific situations, when they should be going back to the hospital. Vitae makes sure that we are hitting those marks, that we are making sure that our outcomes are best for the patients and best for the facility. So I would 100% suggest bringing in Vitae to any facility that is looking into it.